How to establish the diagnosis of HIV in a patient? The diagnostic tests are basically based on antibody testing, antigen testing, and RNA estimation. And the different methods available, these are the common ones: enzyme immunoassay, immunochromatography, immunoconcentration, and particle agglutination. The antibody detection takes an average of around 25 days to appear, and by 3 months, almost 99% of the patients have antibody positivity. Whereas the antigen, the P24, appears earlier. It's an average of around 16 days, and 95% of people from 1 to 8 weeks will be positive for P24 antigen. But this antigen, after peaking at 20 to 30 days, starts to decrease, and after a few months it will be undetectable. So P24 is never used alone for the diagnosis of HIV. It is good to detect the HIV early in a disease phase. HIV RNA is the fastest to appear at around 7 to 14 days, a little earlier than P24 antigen, and 95% of people from 3 days to 6 weeks will have positivity for HIV RNA. But HIV RNA is not used for establishing the diagnosis of HIV in an adult patient. So we have realized that there is a period when all the tests are negative, and this is known as the window period. The first 2 to 3 weeks are very crucial, where many of the tests may still remain negative. If the patient remains negative at 3 months from the index event, it is considered non-infected, because by then almost all patients have antibody positivity. The antibodies, once they appear in the blood against HIV, remain there lifelong. So if we order a test and it comes out to be positive, what do we need to know? We need to do another set of tests. So confirmation of HIV cannot be done just on the basis of one positive test, and the strategies is based whether the patient is symptomatic or asymptomatic. In symptomatic patients, 2 consecutive tests need to be positive, and they should be done with different methods or different substrat. If the first is positive and the second is negative, a third test is advised. If negative, then it is considered negative. If positive, it has to be repeated at 2 to 4 weeks interval. What about asymptomatic patients? They should have 3 consecutive tests with 3 different methods to be positive. So if you have done an HIV screening test for some unrelated reasons, patients who are asymptomatic, then 3 tests need to be done to confirm the diagnosis. HIV RNA is not used for establishing the diagnosis of HIV except in infants, because there is maternal transfer of antibodies from the mother to the infants, and they are invariably positive for the antibody test, but that does not mean that they are infected. Here HIV RNA may have a role in detection of HIV infection. Once established, the RNA tests are done at regular intervals because we want it to be undetectable. That is one of the major important goals of HIV treatment, HIV RNA becoming undetectable. What about the Western blot test? It's a gel electrophoresis. What we have here is detection of antibodies against specific HIV antigens. So HIV antigens are separated, and we tell you against which antigen have we detected the antibodies. Otherwise, when we do the HIV test, they do not specify against which antigen the antibody is present, but here there is specification. But this test is cumbersome, is less available, and it is not mandatory anymore to establish the diagnosis of HIV. So when you have symptomatic patients, at least 2 tests, and when you have an asymptomatic patients, at least 3 tests. Blood banks have a strategy of using HIV RNA testing so that they can detect a potential donor in the window period. They also frequently use the P24 antigen estimation to detect a donor early in the window period, and many of the labs would employ all the 3 testing methods: RNA estimation, P24 antigen estimation, and antibody estimation, so that the detection rates of HIV positivity is high. But in the clinical context of making a diagnosis in a patient, we do not do the HIV RNA estimation. We base our tests either on the antibody detection or antigen detection.